was I on Green Spring? I was right to begin with. Good morning, Kathy, Craig. It's so nice to have you with us this morning.
Good morning, Bob. Thank you for having me.
Kathy is the manager, I should say hospice manager, correct?
Yes, clinical manager.
Let's start off with the basics. Your office, and some people who may be very new here will say, oh, where is this hospice office? So let's start there.
We are located on the terrace level of Village Square, Forest View.
Forest View.
Right down by home health and home support and intermissions.
Okay. And you have within your realm of responsibility nurses, caregivers, am I correct?
Nurses, aides, social workers, chaplain, and volunteers.
And I think last program you mentioned that there were in the teens, how many people in the hospice total?
Probably about 13, 15.
That's what I thought. I remember the days of my dear wife when she was under hospice care and how the nurse would come up once a week and check her out, how the aides would come up, I think, twice a week. If I remember correctly, it's been 09 now since it has occurred. And I have always, to this day, have had pleasant memories of the people in your office and what they have done or what they did for Emily. And I'm sure that goes to all the other hospice patients that we have here in Green Spring.
Very much so. The goal is to get started on hospice as soon as possible, not wait until somebody is actually actively dying.
Yeah.
We want to start our relationships with our patients early on when we're maybe months out, but the doctor is still able to certify that they meet the hospice criteria. We want our families to develop the trust bond with the staff so that they know and they're comfortable with every person coming in, because we almost become like a second family.
Yeah.
And they rely on us to help keep their loved one comfortable, clean, meet any spiritual needs, meet the emotional needs, and just know that they've got that person in the background that's going to assist them when they need it most.
Somebody may ask you about the cost. How much of hospice care is covered by Medicare?
100%. We do not charge our patients.
100%?
We cover 100% of medications for symptom management and comfort related to the diagnosis that we bring them on service for. So if they come on with cancer, for instance, we cover pain meds, nausea meds. If they have enzymes for like a pancreatic cancer, we cover those.
Oh, really?
We cover nausea meds, anxiety medications, meds for fever. Yeah, and we cover equipment, medical equipment, like a wheelchair, hospital bed, air mattress.
I want to go back in time. We had, when I recall, a doctor who was specifically, I guess, titled a hospice. Do we have one doctor here in the medical center that you work with and he or she declares a patient for a hospice?
We work with every single doctor in the
all the
medical
doctors.
center, but Dr. Bethel is our medical director.
Okay.
When a patient comes on service, they can either have Dr. Bethel serve as their primary care physician, or they can come in with any physician that the patient has a relationship with. It could be inside the med center, or it could be outside the gates.
It could be. I didn't know that. I thought it was strictly in-house.
So if somebody has an oncologist that's their primary doctor, they may want to continue that relationship. And if they do, that doctor is the primary care physician, and Dr. Bethel remains the medical director, and she's a support physician in case we need orders in a pinch.
Very important. Now that's, hopefully, I hope that some people out there have recognized what you all do and how it's done. Do you have any updates for us this morning?
Not many updates. I mean, we're keeping busy. We're behaving, and we're servicing a lot of residents on campus. But the big thing, like I said earlier, the big thing is starting our relationship on the early side.
Yeah.
We want to get in when somebody has months instead of days, because we do our best work when we develop that relationship over time instead of just constantly acting in a crisis mode to try to get symptoms managed. We want the patients and the families to experience the full benefits, the emotional support, the spiritual support, because all of that is so integral to the patient's journey through their disease process and preparing for dying.
Your background, are you a nurse?
I'm a registered nurse, yes.
Okay. And your lead nurse in the office is Jane? Or
And she's a registered nurse also. And then I have on-call nurses that are registered nurses.
Oh, you do have other nurses too. I thought Jane would be the only one within your jurisdiction.
Jane is the one that carries the caseload. But the other nurses, the on-call nurses, I have one nurse that does weekend on-call, and I have nurses that split the weekday on-call.
How often do you consult with a doctor vis-a-vis a patient?
Frequent, daily.
Almost daily?
Daily.
Wow, I didn't realize that. So you are constantly discussing the care, the status.
And we're constantly changing a plan of care. It could be changing medications, it could be changing treatments. But yeah, that can happen upwards of daily.
So let us reiterate. What is your phone number in case I want to get in touch with you to discuss some hospice?
703-923-3122.
923-3122, and I see it's up on the board.
And
which
we
is great.
are available to sit and meet with families and sit down and go over what the hospice benefit entails. I would say that if a resident or their loved one out there is going back and forth to the hospital frequently, or they're going back and forth to see their doctor in the med center frequently, weekly, monthly, maybe it's time to sit down and think about the realm of hospice and comfort and quality care in the home setting.
Kathy, you're also telling me that your door is always open.
Very much so. I have people drop in and meet with me.
And if you're busy, they can talk to anyone else in the office.
Yes.
Or maybe they can make an appointment to see you if they so desire.
Yes.
I'm sure. How many patients, did we discuss that? How many patients we have?
On hospice right now, we have 8, 9. I think it's 9. And again, we've been very busy. We're bringing them on, and then shortly after we bring them on, they are passing.
Well, my dear, I think we're just about down to the last minute, if you will. I would like to thank you very much for coming. It's been a joy and a pleasure.